Hello everyone and welcome to today's podcast, which is about a brief discussion about a scientific research paper. I am Saira from Knowledge and Research Support Services Department of University of Management and Technology. Today we have a special guest, a lead author of the fascinating research paper published in our journal. Welcome to the podcast, sir. Please introduce yourself.
Thank you very much. Here is Dr. Numan Javed. I am serving as an assistant professor at the Institute of Microbiology and Molecular Genetics, MMG, University of the Punjab, Lahore. I am serving there over more than 1 decade, and I have been involved in the various academic as well as in research activities. As far as you know that the research is being there, so this paper indicates or elaborate my research area, that is in the microbiology and molecular genetics, and the medical aspect. You can say that the inflammatory processes, host pathogen inflammatory processes that are being involved in this particular process. Thank you very much.
Thank you for your time and your availability and the willingness to share your experience regarding your research you published with the Bioscientific Review in the 3rd issue of Volume 6, 2024, entitled Microbiological Evaluation of Blepharitis, a Case-Controlled Study. I would like to let you know that our editorial board has selected 2 papers from the bulk of many papers based on the clarity, key research areas and importance and novelty of the work, and your paper is one of those 2 selected papers, so congratulations.
Thank you very much. It's my immense pleasure, as well as it is I am full of the gratitude of the Bioscientific Reviews. You can see that all the administrative committee and editorial board for selecting my paper for discussing at this platform, and it is indeed it's a wonderful platform, and it's my pleasure, and of course I will like to discuss all the facts and figures that I have done in my research. Thank you.
Okay, considering the importance of your work, I would like to know the inspiration behind the research work you conducted on blepharitis.
Okay. Thank you very much. As you know that I am a microbiologist, and my area of research is basically the medical microbiology. So whenever we talk about the medical microbiology, so first thing that comes in our mind is the infection or the inflammatory processes. So as you know that the blepharitis is one of the inflammatory process in which there is an infection of the eyelids. Blepharo is a Greek word that means eyelid, and itis means inflammation. So whenever there is an inflammation of the eyelids, so that condition is called as blepharitis. Nowadays here in our community there is a drastic change in the lifestyle as well as dietary habits or demographic changes. So this is a very hot area in order to study the blepharitis, as well as there is an advent of the latest technology. There is an use of the screen or the screen time has been increased so much that leads toward changes in our anatomical structure of our eyelids, and that's why this is very hot area, and we decided we have to focus this area because all the age groups, young adults, children, as well as middle age, as well as old age people, they are severely suffering from this infection. So that's why we have just selected this area.
Dr. Numan, can you explain your main key findings of your research?
Absolutely. Well, this is a very significant kind of research because we have focused the general population who are basically suffering from the blepharitis. So now there is a question that whether there is a crosstalk between the normal skin as well as blepharitis infected skin. So we selected the population of various diverse age group and diverse demographic origin. Among, we have also selected the equal, almost the gender wise male and the female individual or subjects, and we used to collect the skin swabs from the infected area of the blepharitis of the eyelid. Similarly, we also collected the sample from the normal skin of the dead individual in order to evaluate the crosstalk between the normal flora as well as the pathogenic bacteria. So, we found that the females, they are more prone to have the blepharitis. That is very significant as well. And moreover, we found that the infected part of the skin that contains the mostly the gram positive, particularly the Staphylococcus aureus. And likewise, we also found that the Staph aureus that is residing in that particular or causing that particular condition has also the antibiotic resistance, and that's why that is considered as a superbug, methicillin resistant Staph aureus. So that was our key finding. On the other hand, whenever we look for the normal part of the skin, so we found the normal flora, that is the Staphylococcus epidermidis. So that's why this is a very key indication that Staph aureus, which is notorious for the nosocomial community acquired infections, so that is involved in this particular infection.
Can you elaborate why you choose Kirby-Barr method for antibiotic susceptibility testing? And are there any improvements or limitations would you recommend for future studies?
Well, Kirby-Barr method is one of the gold standard method that is being devised by the international standard that is called as an CLSI, Clinical Laboratory Standard Institute. And according to that standard, it recommends that how we can determine the sensitivity or resistivity of any organism against any antibiotic. So this is a gold standard method, that's why we selected this method. And in this method, we have just used Muller-Hinton-Agar as well as a different antibiotics, and that is based on the well-defined method. So accordingly, we have just to determine the zone of inhibition. That's why it is very easy or very appropriate to do this method, and we have a different standards so that we can compare in order to find out. And yes, absolutely, there are a lot of limitations as well as far as concern of the Kirby-Barr method. So nowadays, a lot of molecular techniques, or you can see that the genes which are responsible for causing resistance, we can determine through molecular technique like PCR or other techniques.
Do you think this study will be helpful in defining treatment options?
Well, very appropriate question, because we have found that there are a number of antibiotic resistant Staph aureus causing such kind of infection. So we have an unlimited resource to treat such kind of infection, because those are methicillin resistant Staph aureus. Only the vancomycin or linezolid, they are being there, which are being able to treat such kind of infection. So our have very limited regime of antibiotics, they are being there. So this study directs the clinicians or other health professionals in order to provide adequate possibilities or treatment therapies for blepharitis patients.
In the light of increasing MRSA concerns, what measures should health practitioners and general public undertake?
As far as concern of the antibiotic resistance, so the very important thing that comes in our mind, that is the antibiotic resistant stewardship, that how we can just do it. The first thing in this regard that we should follow, that is we should avoid the self-medication. We have just to consult the clinicians, and we have just to strictly follow the clinician's prescription as far as concern of the antibiotic treatment. Not only related to the antibiotic type, but also with the dosage that is being prescribed for treating such infections. So usually in our community, this practice is very poor. So we used to have the self-medication, as well as we don't bother about the dosage of the antibiotic. That leads towards such kind of superbugs to emerge, and we have an unlimited options. So antibiotics are the drugs, these are not the pills, so we should not use like the pills, we should discourage to use like pills.
Okay, Dr. Numan, would you like to share that what challenges you encountered particularly with the isolation and antibiotic susceptibility testing?
Well, this is a very challenging for us, because you know that whenever you have just to involve such kind of case control studies, so you have just to involve the subjects, and the subject matter you have just to take the on board of the clinician as well as in the subjects. So in this regard, whenever you have just asked the subjects to take the consent for taking their skin swabs, so sometimes they are being a little bit reluctant. So those literate guys, they are easily convinced that what we are just going to do, but sometimes some illiterate person or layman, they are not being able, or they are not being pursued to give the sample. So this is one of the big challenge. And as you know that most of our study focus the public sector hospital of the Lahore, so that's why there are diverse population is going to be there. So we have just to convince, and also we have just to convince the clinician as well, in order to facilitate us for taking the sample of such individuals or subjects.
How do you see your research impacting the future diagnosis and treatment of blepharitis?
Well, this is a very good question, because this study determines the future pathway, that how we have just to move on, how we have just to treat the blepharitis. In this regard, we should discourage the empirical treatment as well as arbitrary treatments. So the clinicians should focus, or they have just to collab with the researchers like us in order to find the latest trends regarding to the occurrence or the prevalence of the organism, as well as the sensitivity or the resistivity against the various regime of the antibiotics. So I think so that this paves the very smooth pathway for the clinician as well as for the patient's healthcare. So we can reduce or minimize the risk of antibiotic resistance among the emerging pathogens.
Okay, Dr. Numan, would you like to share that what other microbiological areas you are currently looking for your future studies, or currently you are working on any related study?
Well, as I told you that my area of interest is in medical microbiology. We are focusing on the superbugs. So we are trying to find out the various alternative strategies in order to treat or curb such kind of superbugs. So we are focusing on the antivirulent strategy, we are focusing on the different other infections like GIT infections, like skin infections, and we are also focusing on other, you can see that the normal flora of the skin that are very, very useful reservoir for the secondary metabolites in order to treat such kind of superbugs. So these are the major chunks of my area of research on which I am working and my team is working, and we are trying to find out such kind of remedies.
Okay, lastly, I would like to know that being an author of the selected editor's choice paper, would you like to share your experience in publishing with Bioscientific Review? How did you find the publication process, or you can say the submission and peer review process? Anything you would like to say?
Well, whenever I selected this journal, so I thought that it should have a very smooth process of processing of the publication. So most of the time I just found this, and it was a wonderful experience to publish our paper in this journal. And the peer review process is also a bit smooth, but there is some room in order to improve, more expedite and more digitalize as well, so that we can just trace or locate that where our paper is being there. And I think so that these are the different suggestions from my side, and in fact it's my pleasure to publish my research work in this journal.
Thank you, Dr. Numan, for your time and the valuable information that Dr. Numan has provided us. Definitely it is going to be added, and it is going to increase the scholar knowledge, and it is going to be beneficial for the academia and for the future researchers as well. Thank you.